After you work on the thigh, then you can move on to the calf. Again, I do a lot of this grasping, but I'm really trying to feel some of the general shapes. Where try to find where specifically the tension is in the calf, and wherever you feel that, try to focus in on it. In this area, things feel a little bit harder or tighter, so I would focus in more on that. You can also, I think when we were doing the grasping, talked a little bit about like grasping the whole muscle and just trying to like lift it off the bone. You can do something like that.
Do you find there's more tension on the medial side or the lateral side?
Let's see. Right now, I've been feeling more towards the medial side. So, yeah, your as far as your hamstrings are. Let's see, which one is it?
Are you flat-footed? Ball and arches?
Yeah, I haven't really searched the lateral aspect here.
I just meant like in general on patients that you work on.
Oh, in general?
Just depend.
Well, there is almost always tension along the lateral on this side. It's almost universal, but that doesn't mean that that's the only regular. But yeah, you can go also by like what Steve was saying. Sometimes when people are laying on on the table, like even like this with face down, like their feet will be like turned inward this way. That usually, when you have people who take a more pigeon-toed stance, it usually means there's tension along the medial, like the part of the kidney channel or whatever, because it's like that's also related to a higher arch, because it's like this part of the foot is too short and tight, so it's pulling the foot this way. And then you can, not as common as like the flat foot where the arch falls, because the outside of the foot is pulling too prominently. Okay.
Do you leave them alone? Let them, lay there the way they naturally lay, or do you straighten it out like that for them before you work on it?
I just
leave 'em
notice it.
alone?
Yeah, yeah. The other thing is that some people, especially like older patients, sometimes they're, they're, what you call it? Like their tibialis anterior, or whatever. I mean, this muscle on the front is so tight that they can't plant or flex their foot this way. So when you put them in this position, like you'll see them up on their toes or something like that. So of course, you want to like put pillow or some support under their ankles or something like that.
You don't want to force them to flatten it down? I'm just kidding. I'm just kidding.
It's like women that wear high heels all the time. You're going to try and stretch that out. Not going to happen.
Yeah.
Oh.
Okay. I think I put something optional after that. Okay, after I do a lot of this grasping, specifically, again, I do this on the floor.
Use your knee.
Yeah. What I do is I put my knee into, and then I just kind of put pressure and kind of move in a circle. also like stand up, and similar to what I mean, but you know, this time I'm facing to the side, and I just step at different parts of the thigh. And at the knee, once you go behind the knee, you can kind of do this nutcracker thing. You can also, as part of the general routine, you can just use your arm and just fold the knee over the arm. This is a manipulation to open the knee joint. The knee is a hinge joint. You can't do too many manipulations on the leg in this position because the hip, you can't really do any hip rotation in this position because it's better to do it with the patient supine. But you can work on the knee. Okay. I like to palm press on the leg, this time with both palms, and I put one hand on the top, one hand on the bottom this way, just like I'm trying to separate or stretch the whole leg. Then I kind of cross, one hand below the knee, one hand above. Do the same thing, like opening up the back of the knee, and then progressively going further apart. Okay, and then after that, you can apply more, at that point, actually I would wait until you did both legs, but you can go on to like the percussive techniques. And some people, they actually really like this kind of thing. When you do the percussive techniques, it feels like you're mobilized. Sorry. Again, skip over the knee,
Amazing how many people like that. Feels good.
Yeah,
So, the different forms, you can just try whatever you're comfortable with. I like to do just the chopping and the double hand pounding swing. Sometimes the lower leg bounces too much.
Good stuff.
So that's primarily working on the UV channel on the back of the leg. So after that, I would do the opposite leg. Yeah, and then I think this is. I don't know if I put this down as optional, but.
You do the foot next, you just keep working on the leg.